Learn about the lung channel of hand Tai Yin, its pathway, functions, clinical applications, and acupuncture points for treating respiratory disorders and emotional imbalances. Question 1. Why is it important to understand the interior flow of meridians in acupuncture? A. Because it helps locate the exterior acupuncture points more precisely. B. Because it allows influencing meridians indirectly with fewer needles. C. Because it determines the tonification or sedation technique choice. D. Because it identifies which points are used for bloodletting.
Question 2. Which lung meridian point is considered the cycle, Xi, point and useful for acute stage disease treatment? A. Lung 10. B. Lung 7. C. Lung 6. D. Lung 8. Question 3. For what conditions is the lung meridian point lung 10 especially used? A. To tonify lung yin and treat respiratory illnesses worse in wet-cold weather. B. To disperse energy quickly in acute lung disease. C. To treat neuropathy and numbness by oxygenating nerve cells. D. To sedate excess mucus edema and reduce heat. Question 4. Which acupuncture point is known as an oxygenating point used for multiple sclerosis and Alzheimer's treatment? A. Lung 6. B. Lung 4. C. Lung 9. D. Lung 1. Question 5. What is the role of the lung meridian point lung 7? A. It is the cycle point dispersing energy during acute illness. B. It is the connecting, luo, point linking lung to large intestine meridian. C. It is the fire point promoting warming energy. D. It is the tonification point for lung yin energy. Question 6. What is the significance of the acupuncture point lung 1 on the lung meridian? A. It is the tonification point used for respiratory illnesses. B. It is mainly used to treat neuropathy and numbness. C. It is the cycle, Xi, point that disperses energy quickly. D. It is the alarm, mu, point used to detect organ dysfunction. Question 7. What is the significance of the last point of the lung meridian, lung 11? A. It connects the lung meridian with the large intestine meridian. B. It is often used for bloodletting to treat inflammatory diseases of nose, sinuses, and throat. C. It is the tonification point used to energize tired patients. D. It is the fire point used to tonify lung yin. Question 8. Which lung meridian point is called the metal element point and can both sedate and tonify lung yin? A. Lung 6. B. Lung 10. C. Lung 8. D. Lung 9. Question 9. Where does the internal branch of the lung meridian begin? A. At the ventral aspect of the arm. B. At the corner of the nail of the thumb. C. At the large intestine. D. In the interior of the middle warmer. Question 10. What purpose does the point located in the cubital crease on the radial side of the biceps tendon serve? A. It connects the lung meridian with the large intestine meridian. B. It is used primarily for bloodletting in inflammatory nasal diseases. C. It sedates excessive mucosal edema and lets out heat. D. It is the lung meridian's fire point for tonification. Question 11. What does palpable change along the lung channel typically indicate? A. Problems with qi circulation involving the lung channel. B. Skin infections around the lung area only. C. Muscle overstretching in the arm only. D. Bone fractures in the forearm. Question 12. Why might the lung channel show frequent changes in a variety of patients? A. Because the lung channel is rarely treated and thus shows more issues. B. Because the lung channel is the only channel on the arm. C. Because the lung channel is the most superficial channel. D. Because the lung qi governs all bodily movement, affecting many pathodynamics. Question 13. What clinical approach is suggested before treating the primary affected channel if lung qi stagnation is involved? A. Avoid any treatment to the lung channel to prevent further stagnation. B. Treat only the primary channel directly without prior regulation. C. First regulate lung qi generally using uniting point on pericardium and spleen. D. Only treat the lung channel if there are no other problems. Question 14. What does it mean that the lung rules the 100 vessels in traditional Chinese medicine? A. External qi brought in by the lungs enters all vessels of the body, influencing their functions. B. The lung is the only organ with blood vessels attached. C. The lung supplies oxygen directly to all vessels. D. The lung physically controls all blood vessels by muscle contraction. Question 15. What symptom around lung 6 is indicative of bleeding or bronchial problems? A. Indentation in the muscle tissue. B. Excessive sweating. C. Paleness and dryness only. D. Darkening of the skin and papules. Question 16. What does a strong pulse palpated around lung 5 indicate? A. Internal cold syndrome. B. Chronic lung deficiency. C. Blood deficiency. D. Presence of external disease. Question 17. What do papules at lung 1 and lung 2 commonly indicate? A. Deficiency of lung qi. B. Cold dampness in the lung. C. External trauma to the arm. D. Heat in the lung channel. Question 18. What might a very deep pulse around lung 5 indicate? A. External heat invasion. B. Normal healthy lung function. C. Excessive dampness in the lungs. D. Lung qi deficiency. Question 19. Why is the discussion of qi circulation often started with the lung channel? A. Because the lung commands qi and governs breath, bringing external qi into the body. B. Because qi flows only through the lung channel. C. Because the lung is the most painful channel to palpate. D. Because the lung is the largest organ of the body. Question 20. Which sign around bladder 13 or lung 1 might indicate lung qi deficiency? A. Excessive moisture and oiliness. B. Hardness and lumps. C. Weakness, muscle softness, and dry skin. D. Redness and swelling. For answers, click the video link at the comment section below. Thank you for your attention.